Hello, everyone, and welcome to today's webinar, The Impact of COVID-19 on Social Work Practice, a collaboration between the Manitoba College of Social Workers and the Canadian Association of Social Workers. My name is Sherilyn Lam, and I'm a graduate student with the University of Manitoba and working on a placement at the Manitoba College of Social Workers. I will be moderating today's session. We are happy to be co-hosting this webinar from the land of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We also welcome participants who are joining us from treaty territories across Canada and acknowledge with respect the diverse histories and cultures of Indigenous peoples across the country in the spirit of reconciliation. Today's webinar session is interactive, and you are invited to ask questions of our panel members. The webinar will be approximately 60 minutes, beginning with a brief introduction from each panel member, followed by a question-answer period. There are no slides for this webinar, so you'll just see the video of the panelists. And also there is a short poll that you can complete at any time during the webinar. It's located at the bottom of your screen. It's one of the blue circles at the bottom there. I encourage you to type in your questions in the Q&A box at any time during the hour, and we will respond to as many questions as possible during the presentation. Please note that a recording of this webinar and your certificate of attendance will be available on the website through the CASW member portal following the live presentation. So I'm pleased to welcome our panelists for today, Vicki Burgess, Richard Delarond, and Beth Rogers. Vicki Burgess has been a member of the Manitoba College of Social Workers Board of Directors since 2015 and President since 2017. In addition to her role with the college, Vicki wears many hats in her position with the Winnipeg Regional Health Authority, where she is the WRHA Regional Director of Social Work and the Manager of Social Work and Spiritual Health Departments at the Grace Hospital. Richard Delarond is a First Nations person and a band member to Sandy Bay Ojibwe First Nation. He holds a Bachelor of Social Work degree and a Master of Social Work degree in Policy and Public Administration. He is a registered social worker with the Manitoba College of Social Workers, a previous member of the Manitoba College of Social Workers Interim Transitional Board, and a past president of the Manitoba College of Social Workers Board of Directors from 2015 to 2018. Richard is currently the Executive Director of Sandy Bay Ojibwe Child and Family Services and has been in this role for over 15 years, but has been involved with child welfare in Manitoba for over 20 years in various capacities. Some of his key activities include contribution to the Province of Manitoba's conceptual plan for the devolution of child welfare services, mandate work for Anamiki Ozozone CFS, Anchor, and Sandy Bay CFS. He's the author of the Workload Review Project, The Perpetual Journey Managing Workloads in Child Welfare, co-editor of the editorial review Aspects of Aboriginal Child Welfare in Canada, and a course designer and a content specialist for the University of Manitoba Faculty of Social Work. Beth Rogers is a social worker with the Winnipeg School Division. In her current role, she manages a multidisciplinary team of clinicians working in Winnipeg's North End. She also supervises school social workers throughout the division. So welcome Vicki, Richard, and Beth. I'll hand the floor over to you to lead our discussion with a brief reflection on social work during COVID-19, after which we invite attendees to submit questions in the chat box just located at the bottom of your screen in one of the blue buttons.
Good afternoon, everybody. My name is Vicki Burgess. I think I'm going to go first because our introduction started with me. So I wanted to just reflect a little bit about the practice of social work in healthcare. Here in Manitoba, the social workers work in our community programs, home care, community mental health, our primary care settings. our long-term care settings, our personal care homes, as well as in our hospitals and our healthcare facilities. So it's quite broad, as I'm sure it is in other provinces. So I tried to reflect a little bit about how it might have impacted all of us in our different programs. And really, the biggest thing that I wanted to reflect on is that COVID-19, as I'm sure everybody can think about, it just wasn't one single event. The impact on our practice, it was just been a cascade of different things that have happened. And each day brings new things that we've needed to adapt to and adjust to. So one of the biggest things I'm sure that my fellow panelists will also say is the impact on our direct care. So we're so used to building relationships in our practice, and I think we pride ourselves as social workers on developing those relationships. And, having to wear PPE, having to provide our services virtually has had a significant impact on how we develop our relationships and how we sustain those relationships. We're experts in crisis management. We always have been. So I think that for the most part, social workers across healthcare, rose to that challenge and provided care. But what the impact has been is significant amount of, emotionally labor intensive work. So we're used to dealing with death and dying in healthcare, but we've seen more people come into the hospital and die quicker than perhaps we're used to. So managing the bereavement of families and next of kin who couldn't be here to be with their loved one, having to support families in saying goodbye through an iPad, through Zoom, through FaceTime. As much as the social workers facilitated all that and bridged all that, the emotional impacts on them is quite significant. And I think that as we go forward, we're going to see the impact, those hidden harms, and what that might have had on our social workers in healthcare, not to mention what the hidden impacts have been on our clients and patients and family members in our communities. But some of the other things that the social workers have had to change their practice is really working together to support people who are COVID positive and ensuring that they can get into an alternate accommodation so that they can isolate and protect themselves, protect their families. So as much as we've always been really good at advocating and supporting our patients and supporting our clients, we've had to navigate new systems and new community programs and programs that have just kind of popped up overnight and maybe not know as much about what the eligibility requirements are and who gets to be referred to those programs. So having to learn a lot about those new programs and then having to try to navigate to figure out, will this particular patient or this particular client be able to be accepted into this program. I think like everybody, we've always been managing our own personal fears and our own personal anxieties about COVID and what the impacts might be on ourselves and might be on our own families. So as our caregiving has gone up, our challenges have gone up, we're still coming to work every day. And that's one of the things that might be a little bit different than other programs. For the most part, if I was to talk about hospital care and if I was to talk about long-term care, we weren't able to work from home. We came to the hospitals, just like our fellow nurses and our fellow physicians and our fellow allied health members. Many of our facilities, we weren't able to work from home. So we continued to manage our workloads, manage those fears, manage the PPE requirements as needed while we were present and in the hospitals. So I think that's my quick overview. I'm sure there's lots more that I could say about the practice and how it's changed, but for the most part, it was learning how to navigate those relationships virtually and supporting our practice when people aren't there in front of us. So I'll turn it over to my other fellow panelists to give a quick overview of how it's impacted their field of practice.
Hello, everyone. I guess we're following the introduction order, so I'll jump in there and go next. My name is Richard Delaron. As you heard, my introduction was actually quite long I found, compared to everyone else's, so I'll just jump right into it. In terms of how the pandemic impacted child welfare for Sandy Bay, and that's the experience that I'm speaking from, and it may have been different at other agencies. The where in terms of child welfare for Sandy Bay, where we were providing our services, changed. And unlike folks in education or in the health sector, our social workers did go home. They did work from home, responded from home. Because we're in child welfare, we're guided by legislation and standards. So there's a lot of things that guide what we do, and it's not really the where that's important. So we were fortunate that when we did close our offices, that we're still able to maintain a certain level of service to the children and families that were out there. If you all remember the 90s and H1N1, one of the things that helped us in Sandy Bay is some contingency plans that we had put in place. And you never expect, writing a contingency plan almost 18 years ago that you'd actually have to use something for pandemic-wise. But it was certainly useful in terms of the planning, what services were going to look like. And there were some things that surprised us during, the last year of trying to provide those services. There was a complete halt to any kind of prevention, family enhancement programs that we were delivering, because those were largely done in a group setting. So those came to a grinding halt, and which was unfortunate because our experience was that those programs, those family enhancement programs, really did contribute to keeping children and families out of care. So to have to not provide those services, we certainly saw it began to have an impact on some of our families. Another thing that became sort of present for us and obvious that we didn't think was happened, that we found that social work wasn't really considered an essential service. And we started hearing that in terms of, who can get vaccinated, or, stores were offering services for frontline workers or essential services, and social workers were on that list, and it impacted our ability to provide, whether it was clothing, emergency food, for families that needed them. We weren't able to secure those, and it took a little bit of pushing, try to establish that, social work and child welfare was an essential frontline service. So that was sort of caught us off guard. We always felt that social work is an essential service. So navigating those were one of the things that we didn't expect we would have to do. And then just placements. We had a couple, probably one of the toughest things we had to deal with was some placement breakdowns where we had some children in care that were just not willing to abide by, the pandemic rules and stuff, and they were out gathering. And we had a few instances where foster parents didn't want those kids back in the home unless there was some form of test. And so, again, Sandy Bay pushed for there to be some kind of rapid test results for children in care, where we would have these kids that were not being welcomed back into their placements because they had been gathering with other people. And we really struggled with how do we get these kids tested quickly so they're not sort of in limbo. And we still haven't answered that question. I mean, pilots and other things is one example where they're in a flight, and as soon as they land, they get their tests, and if they test positive, they stay in a hotel. If they test negative, they can go home. And we were trying to find a company that would do that for children in care in those instances where foster parents did not want a child back at home because they had been things. So still trying to navigate that. I mean, we're fortunate that it wasn't a huge occurrence, but certainly we struggled navigating those kind of things. So that was something that we didn't expect as well. And then, this on the education side, when schools were closing, we had a few instances where, foster parents wanted to homeschool their children, and it wasn't clear what the rules around that were. Particularly for us, we had to do some research, and we quickly had to come together and come up with some policies around that. And like if your school is open and you weren't registered with the province to be homeschooling, then those were requirements that had to happen. So there's so many. I can talk for hours about some of the things we had to navigate. And as Vicky said, a lot of that navigation and a lot of the things we had to come up with was done collaboratively. We're fortunate at Sandy Bay that when we make decisions at our agency, they're done collectively as a group, and it's not me barking orders or saying this is how it's going to be. And I found that maintaining those relationships with the families and children that we serve, there was a lot of trust when we had to enter a home, for example, for those every 30-day face-to-face contacts. We started to use technology like iPads and stuff to do video conferencing and doing home studies through video, and it was a learning experience, and it's I feel we were able to maintain a level of service that Sandy Bay CFS prides itself on. So it certainly had its challenges, but being surrounded by the people that I work with at Sandy Bay, the colleagues and the other service providers really help us navigate those things. And so I look forward to your questions, and thank you very much for participating today, and happy Social Work Week. Thank you.
And our final panelist is Beth, and I'll just let Beth go ahead and give us a brief discussion about social work during COVID within her field.
Hi, Beth. Can you hear us? So yeah, you can go anytime and just give us your.
Thanks, Richard. There was so much in common with both what you and Vicky said. Towards the end, you were speaking about shifts in education and how challenging the pandemic was to know how to help kids access schools. Thanks very much. And thank you both to Richard and Vicky for setting the stage. There's so much in common with the experience here in the school system with both health and child welfare. One of the things that really struck me as I reflected on the past year was the resiliency of our profession. You know, I work in such a broad, multidisciplinary department. It's amazing to see just how quickly social work was able to adapt. It's kind of like social work is water. You change the container and we just fill the container in the new and different way. And it changed radically over the last year. Many of the social workers that work here in the school division have worked in other areas and have gone through lots of transitions and reorganizations and are very experienced at that and managing it. What was different about the pandemic is that it wasn't just our workplace that was shifting. It was how the pandemic was affecting us on all levels of our lives. It affected us professionally. It affected our day-to-day work. It affected our feelings and perceptions of safety. Hi. Yeah. Can you not hear me? Very good then. I do understand that there's a bit of a lag, so I'll just continue talking. I was just, I think, discussing that how well social workers manage the transitional place. And what was different was that there was the impact of being affected personally and professionally and being concerned about safety at the same time. One of the challenges that we faced as schools, like health, I'm sure, and like child welfare, are highly structured institutions, and they're generally quite formal with well understood ways of practice for social work and other professions. So one of the difficulties is that all of a sudden on the fly, needing to abandon long held practices so that we could meet the needs of students and families and staff in the new landscape. So we found ourselves doing things that we wouldn't have even thought possible, even just a few weeks before. So one of the things that we took away as a positive was our rapid uptake and ability to use technology. I'm sure others have had that same experience where we will never go back to the same situation of not being comfortable or familiar with working with children, working with families using technology. There's also an incredible opportunity, a real focus on something that social work has long understood, which is aspects of equity and marginalization. You know, for the education field, when in the spring, everybody went to learning at home, it put into sharp focus the conditions under which many of our children and families operate in every day. So access to resources, access to technology, having a home that's able to support people working from home or going to school from home, and how that made it different right across our whole division and our work lives. We're pretty big on boundaries in school social work. It's important. It's a really key part of our work. So another thing that I'm reflecting on is, you know, what it was like trying to maintain boundaries while you were on a important work meeting or meeting with a student individually, while also parenting your own children and helping them with their education and trying to keep your dog from running across your video screen. So it was just an incredible opportunity to stay focused on values and have a value-based practice when it felt like somebody had shaken up the world, like with a snow globe. Too, as I reflect, like the spring was absolutely wild. We never work from home in education. It's something, we've gone 20 years without a snow day here in Winnipeg. We come to work every day. So to find ourselves home with 1 week's notice was really disconcerting. And then rapidly to have to return in June, that was another transition. And then the fall was really challenging too, because that was the time when the codes were changing rapidly. Teachers set up their classrooms and we managed a system of remote or virtual learning. And then at the end of October, everything changed again. That was really challenging. And then it seemed to me that after January, we reestablished sort of a new normal of working in a way where we were live in the building with students and also supporting remote learning and also supporting virtual learning for other students. And again, through the lens of social work, where we see all the equity and marginalization issues reflected in those different layers and styles of learning. So it's been a very interesting year, and it's been a great opportunity, I think, to really get back to the basics of social work. And it's all about connection, and it's all about relationship, and it's all about finding our way. So anyways, thank you very much for your attention. I will stop talking now and turn it back over to our moderator.
Thank you, Vicki, Richard, and Beth, for that overview of social work during the pandemic within your fields of practice. So now we're on to our questions. Again, I encourage the attendees to type in their questions in the Q&A box just located at the bottom of your screen. It's one of the blue buttons there. So our first question is, how has social workers in your field helped clients to cope with the increased social exclusion? And I will let our panelists answer that question, starting with Vicki.
I think that much like my colleagues talked about, we here in healthcare have really relied on learning how to Zoom, how to FaceTime, how to do MS Teams. So with the hospitals and our healthcare facilities and our long-term care settings, majority of those places, as Beth referred to, we went through different transitions, but as the different orders were rolled out by public health, that had an impact on whether or not visitors could come into a healthcare facility. And so for the most part, I would say we have not been able to support families, next of kin, friends visiting their loved ones here in our healthcare facilities. And so really just relying on phone calls and leaving voicemails and encouraging iPad visits. One of the things I'd like to just share as an example, although not solely a social work initiative, social work played a role in what we called our family liaison positions. And so in our in our ICUs, or in intensive care units, we, along with collaborating with our other healthcare professionals, encourage regular access between the care team, the patient, and families or their loved ones outside of the hospital by ensuring that they could participate during rounds virtually. So that meant phoning families the day before, finding out if they could participate, if they wanted to participate, if they had questions for the physician or the nurses or anybody else on the healthcare team, and then making sure that that next day we were present, or the family liaison was present, or the spiritual health provider might have been present, in order to ensure that that family could connect with the team and ask the questions that they needed to ask. So that's one example.
What a great question that was. what was eye opening for us was, our child welfare in particular is you come to us in general, in terms of, we make appointments for our clients to show up for the office, whether it's a meeting with the social worker or it's for a family visit. And the pandemic required us to flip that around, and it was really eye opening in terms of the mobility of our clients and their ability to get to the office for any kind of meetings or appointments or visits, and for us to be able to bring the social work and bring the service to the clients in their homes was very opening for us, and it's something that we may continue to do post pandemic. The necessity of maintaining office space or having visits in an office environment is something that we're really taking a look at. So a lot of our processes may change in terms of how we provide that service to our clients. So it was certainly eye-opening to make that transition to in-home, to almost an in-home social work service for child welfare. And then to have to do some of those things through the use of technology, like my colleagues have talked about. So I hope that answered your question. Thank you.
So when Beth, like it's more than 30 seconds.
Hi everyone, sorry, we're just experiencing a bit of a lag, but Beth will answer next.
I'm going to jump in here real quick. I think Beth's having some lagging issues. I got to see a question here from Bree about technology, and a question from Laura. Let me see if I can just answer those real quickly. In terms of technology, Bree, we had to bring out, what we did is we brought out iPads that had been sterilized. They were in a Ziploc bag because, as you pointed out in your question, a lot of our clients don't have access to that technology. So what we did is we brought out that technology to them. And once, whether it was a home inspection, whether it was a home visit, whether there was a face-to-face contact with children in the home, we brought the iPads there that were connected to a cellular network. And once those meetings or those things were done, they were returned to us and then re-disinfected. And that's how we engaged our families for the ones that did not have access to technology for any kind of video conference or meeting or what have you. And for Laura, your question about mental health of workers, I haven't heard too much. I mean, there were some instances where we had to deal with people that were not comfortable going into homes, regardless of having the PPE, and to navigate those from a human resource perspective. I mean, Sandy Bay is a non-unionized environment, so I would imagine how you navigate those things are a little different in those environments. But in terms of our mental health, and I found for the most part that the feedback I got from social workers was positive in terms of having the flexibility to work from home, which in terms of access to services or clients, I know that some social workers were meeting with clients outside of regular business hours, and those were arrangements that they made with their individual clients. So it certainly brought about a lot of flexibility. And certainly in Sandy Bay, we weren't about, okay, you're working from home, your hours are 8:30 to 4:30. We were more about the quality of the work that people were doing rather than the quantity. So there was, I didn't get that too much, but there certainly were instances where people were struggling with some of their own isolation, and how we dealt with that was through conversations with supervisors or myself, and try to be flexible in terms of if people wanted to come to the office that they could, to try to maintain some level of normalcy. So I hope that helps. Thank you.
Hi there. I guess we're responding to questions about mental wellness and mental health for the social workers as they were also going through and trying to support others. Absolutely. One of the things that we noticed here in the school system is that there was such a huge system-wide impact that social workers were being called on to support other adults in the system because everybody was just so impacted by so many things and by so much disruptions to normal practices. So I think that really weighed on social workers during this time because they felt the need to look after themselves, look after their families, and respond to multiple new challenges in the workplace. So boundaries became really paramount, and self-care became really paramount. And strangely, you would think that an opportunity like last spring to work from home, we had that briefly for a few weeks there, would bring a sense of ease or help people in managing stress. But it seemed to just create lots of role confusion. People were doing multiple things all at the same time. It was really challenging. So yeah, thank you.
I'm going to jump in and just respond to the mental health of staff as well. I know that as a health authority, we established a psychological response team, and we certainly pushed out a lot of resources and a lot of advice. There was a lot of workshops, or I guess webinars online for people to participate in. But I'll be honest, with the workload being as high as it is, and everybody trying to navigate so much, I'm not sure that they always had the time or the ability, or, you know, one of the things that social workers often do is we put other people before ourselves. And so I do think that a lot of people are just now starting to really feel tired and feel that fatigue, whether you call it compassion fatigue or just that things are catching up to them. And for those of you who are joining us from outside Manitoba, you'll may or may not know that it's very cold here in Manitoba during the winter. So just our ability to get outside is very different. But I think now with spring coming, you know, there's more opportunity to get out, to maybe go for a walk and to let go of some of the things that we are carrying throughout the days. So I'm optimistic that, and I'm hopeful that people will start to, now that redeployments have maybe ended, because that's another thing that we did have to deal with here in our healthcare system. Much like Beth was talking about, you know, learning to navigate and go to a new place, and you're no longer working with your colleagues, and you're no longer working in an environment that you're used to, and you're no longer doing the job that you used to do. So some of those redeployments, all of those kind of things are slowly starting to transition back a bit. So I'm hopeful that people will now start to take a look at themselves and start to do the things that they need to do to self-care.
Thank you very much for those answers. Our next question is, have clients expressed concerns with the reduced in-person supports or the move towards remote contact, such as gaps in services, and how have we responded?
I think I'll just jump in real quick and say that certainly I do feel that I've heard from clients personally in my leadership role that they've struggled very much with maybe not so much the client here in the hospital because we can see them, but just even if you've never tried to provide care with your PPE on, and I'm not a frontline worker, so I don't have to do it often, but I will speak to the few times that I had to do a medical assistance in dying interview with PPE on, and the patient has PPE on. It's just a barrier. It's really hard not to be able to respond to some of the nonverbal cues that you get when you're working with a patient. So certainly I've heard from patients, and I've certainly heard from families that many times the virtual telehealth has been helpful, and I think there's lots of benefits, and we will probably adopt many of those going forward. It doesn't eliminate the need for that in-person contact and those conversations and those systems meetings where everybody's in the room and can collaborate and work together on some of the more complicated situations. So I think that what I'm hearing from patients and families is that, you know, hopefully as some of the code red restrictions decline, that there'll be more of an opportunity for them to participate in
I think for us, doing the like I had mentioned earlier, the inability to provide any kind of group setting enhancement, cultural stuff with some of our clients certainly had an impact. Certainly around domestic violence, we've seen a spike in that during the pandemic in the homes, and I guess it's just a matter of being isolated around people. So one of the things we did try to do was do a lot of one-on-one stuff, but absolutely there was an impact on families where in the past when we provided those services, those sort of prevention services to families and intervening before, you know, there were child protection concerns, certainly had an impact on the families that we were working at, not to be able to do some of those things that we found successful pre-pandemic. But at the same time, there were some successes doing some of those things one-on-one with clients. And just because, your attention is focused a little more when you're doing one-on-one stuff. And so there were some successes, but certainly the absence of those programs and resources had a significant effect for sure.
Yeah, we noticed a huge impact on families and students during this time. Everything from little children having to accommodate to, like for Vicky was saying, the PPE really getting in the way of how children connect to adults. Parents haven't been allowed in schools the whole year, which drastically changes our landscape and really shifts the load on social workers because of the need then to go out and do home visits. It's very difficult for parents to maintain a meaningful connection at schools when we need to keep schools in sort of a quasi lockdown all the time to minimize transmission of the virus. So the impact of PPE, the exclusion of parents from the school grounds, and then the students themselves missing all of those really important parts of school life. They're missing the social pieces, they're missing the physical activity, they're missing music and arts. A good portion of the day, of course, is driven by how we keep each other safe. So all of the things that needed to be put into place, the frequent hand washing, the different way of doing recess, the need to split classrooms into 2 or 3 different locations to keep everyone safe, and the need to accommodate that shifting landscape of remote, virtual, in-person, or hybrid learning means that we're always adjusting and readjusting. So just helping students find that stability has been really key. And I think social work's played a role in acting like the glue to keep all the pieces together, but it sure has been impactful.
Our next question is, have social workers taken on new roles that weren't originally social work roles, or has there been new positions created for social workers as a result of this pandemic?
So here in healthcare, what I should probably say is in the Winnipeg Regional Health Authority anyways. I can't speak for other parts of the province, but we certainly did come up with what we would call models of care. And so I wouldn't say that there's been new roles or new positions created for social work, but what I think it did was, as the nurses and as physicians, as our medical staff needed to really focus in on some of the medical issues that were going on for our patients and our clients, social workers' scope of practice, it can be quite broad. And so I think, as we always do, social workers stepped into those roles, right? They picked up some of the things that maybe other people could have done. And that's what we find it happens in a collaborative interprofessional practice, is that there's a little bit of a gray zone where we kind of overlap sometimes. And so I would say that social workers kind of moved a little bit more into those where they needed to in order to support their patients and families, which is what I see social workers do all the time. But of course, it's just even more identified now with so much going on and so many things that needed to be done in a day. So I would say that certainly there have been opportunities that social workers have been redeployed to. So in some situations, we have had social workers at our testing sites. They haven't actually given a test, or they actually haven't provided a vaccine, but certainly the social workers have been redeployed to assist in supporting patient care and supporting processes, which again is part of what we do. But I think just a little bit more of an opportunity for us to showcase our skills and our breadth of our knowledge and the breadth of our scope of practice.
What a great question for Social Work Week, Alyssa. And I mean, just speaking to the mobility of having a BSW or MSW or working in the field as a social worker, I think this in my whole experience in child welfare and doing social work in general, even pre-pandemic, you've seen a change in schools and hospitals where, some traditional roles were provided by psychologists and other people, and seeing those roles transition into social work positions. I've got many friends that work in health, that work in education in schools, where once upon a time those were psychologists. In child welfare in particular, was there new positions created at Santa Bay? Not necessarily, but we did see an uptake in request for social work services, if that makes any sense. But certainly there were no real new positions as a result of COVID within our agency anyway. But certainly a request for those services increased. Great question. Thank you.
That is a really good question, and I agree with what was just been said. While there weren't new roles created, that gray zone, as Vicky said, sure came into play, and especially in the spring when it really felt like the wheels were coming off the road a little bit. I think about the school social workers who started working on the food security programs that the school division was running. Delivering hampers, maintaining connections, being very mobile, very fluid, very flexible. We did see a big change in our role in that a lot of the work that we did that would involve small group work ceased, and it still ceased because we've got to be so conscientious about not mixing cohorts. And that meant that our work shifted in two ways. It did shift to emphasizing even more one-on-one support for individual children and with parents. And it also shifted towards more classroom-wide or school-wide in terms of mental wellness programming and also community-based supports. We have been finding, just because of the limitations, that the landscape of our not-for-profit sector and our community-based supports is shifting. So I think we have seen some softening of the roles in school social work, just in terms of a little bit more fluidity. Yeah, very good question.
And our last question is, have you seen any ethical issues related directly to the pandemic response within your field, and how have you managed, or how can we as social workers manage these ethical issues?
I can think of quite a few different occasions where ethics has risen up in the last year because of COVID-19. One of the examples I will reflect on is, probably a little bit of ethics, but also a little bit of equity. And that is, seeing some very vulnerable people come through our emergency rooms and trying to help them navigate, balance the choices that they want to make and how they wish to live with being potentially positive for COVID-19, and trying to protect not only ourselves as social workers and our colleagues here in the healthcare system, but also wanting to protect the greater public as well. So on the one hand, knowing that perhaps somebody who is COVID positive or COVID positive suspect should go to a shelter and should isolate, also recognizing and knowing that that patient or that client has no desire to do that and probably will not be able to comply with some of the expectations that would be placed on them, and just how do you navigate that? How do you balance your client and your client's choices, that right to self-determination, but also navigating protection of the public as a whole. So that would be the one example that I don't have the answer. That's the thing with ethics. There's no right or wrong answer. Each case has to be looked at differently. But that was one of the most significant challenges that I saw over this last year.
I'm going to answer this question probably not in the way you meant for it to be answered in terms of ethical issues, but for us, our practice in child welfare is heavily guided by standards and regulations and legislation. And during the pandemic, there were certainly instances where, certain things in child welfare need to be done at a certain speed. And then there's timelines around abuse investigations and responses to intakes. And the pandemic certainly caused some non-compliance with some regulations and standards in terms of what timelines look like. But we found that sometimes those timelines are not realistic, and sometimes they don't give families that extra bit of time to get to where they need to be. So, our agency sort of struggled with the ethical dilemma of circumventing or being in non-compliant with standards and regulations in terms of timelines for certain things. But when your outcomes are positive, when you do those kind of things, it's hard for government to come back and say, hey, you're being non-compliant when you sort of have certain outcomes as a result of circumventing those policies or those things. But certainly, it's something that we talked about frequently in terms of being non-compliant with certain things. And, maybe it's something we'll continue to do after the pandemic just because of some of the results that we achieved in giving some people a little bit of extra time. So, thank you.
Yeah, when I think about the question around ethics, it was such a good case study in the importance of having a value-based practice, because we rely so often in education, and I'm sure in health and child welfare as well, on policies and procedures. And we didn't have any. None of our policies or procedures were effective because they'd all been rendered null because of the lockdown. So that meant relying on values became really important and guided decision-making, and really, I think, helped lower people's anxiety, because social workers get really worried when they feel that they're working outside of established practices. So being able to just guide all the questions around our value statement, which was very active and very much in need, really supported us, I think, in making ethical decisions in uncharted territory. So yeah, thank you.
Well, the time is now 1:30 and our session has come to the end. Before we leave, I'd like to thank our panelists, Vicky Verge-Burgess, Richard Delarond, and Beth Rogers, for sharing their experience and insights about the practice of social work during this pandemic. I also want to thank all the participants who have joined the session today, and remind everyone that a recording of this panel will be available on the website through the CASW member portal following the live presentation. And as we've reviewed the impact of COVID-19 on social work practice, I'd like to close by acknowledging social workers across the country for their dedication to our profession. I'd also like to take this opportunity to congratulate all the Manitoba College of Social Workers members, our MB recipients of the 2021 CASW Distinguished Service Awards. Thank you for your services and support to Manitobans during the pandemic. You are essential and you are very appreciated. Happy Social Work Month, everyone.